A few decades ago, it was rare to see groups of people gathered outdoors to smoke. It's not because there were fewer smokers, it was because people were free to smoke indoors.
Smoke, smoke, smoke that cigarette.
The television series Mad Men shows what it was like in the 1960s when it seemed like everyone smoked. Dashing corporate executives and glamorous housewives had a cigarette in hand, whether it was in the boardroom or in the bedroom. 50% of the population used cigarettes. Those who didn't just had to bear the secondhand smoke.
I burned holes in every dress I owned. I choked myself to death.
Geneva Dixon remembers those days.
It looks so smart. You have a drink in one hand and a cigarette in the other, you know, and you were so sophisticated. And now you're not.
She frequents this restaurant with her friend Terry Clark, a smoker of 44 years who lit his first cigarette at age 14.
And I smoked all the way, and then, of course, I've tried a couple of times to quit, but as we talked about, it was for all the wrong reasons. It wasn't because I wanted to, and really, I don't want to now.
There are very few restaurants in Oklahoma which still allow smoking. In 2006, a law went into effect that required restaurants to create separately ventilated and enclosed rooms if they wanted to allow smoking. Less than 2% opted to do that. The owner of the Corner Cafe restaurants in Tulsa was one of them.
They want smoking area, and they better stand up outside and stuff like that, because I have the opportunity to do it because I have all the way separate air conditioned, separate like this. I decide to go for it.
Ollie Cater thought he would lose customers if he didn't offer a separate smoking room. He says that might have been true at first, but he doesn't think it really matters anymore because people are so used to places that don't allow smoking. So, how does Terry manage his habit at work?
Well, they have a what they call the smoke hole where you have to go to smoke. They used to have several areas that you could smoke in, and now it's all of a sudden now it's restricted to one small area. There's guys that I know that smoke, that won't smoke in their house. They smoke out on the porch now, and it's a whole different society as far as smoking and what's going on in this society.
Today, there is more money than ever to try and help people quit smoking.
So in the early years, let's say when I was first hired in 2002, we had about $500,000 to spend. This year, we've had $35 million.
Tracy Strader is the executive director of the Oklahoma Tobacco Settlement Endowment Trust, known as TSET. The amount of money in the trust grows each year as the tobacco industry fulfills its obligation to make billions of dollars in payments to Oklahoma and other states over the course of 25 years. The payout is the result of the 1998 landmark tobacco lawsuit settlement, which allows states to recover tax dollars lost treating smoking-related illnesses. Oklahoma was the only state to set up an endowment for the settlement money, and the trust amount has now grown to $700 million.
That's really, I think, the genius behind the way the endowment was structured, is that because the money is invested and we're just providing funding for the programs out of the earnings, then we'll be able to sustain these programs and others for generations to come.
A lot of the earnings money has been spent on smoking cessation programs.
Thank you for calling the Oklahoma Tobacco Helpline.
The Oklahoma Tobacco Helpline, 1-800-QUIT-NOW, has counselors available 24 hours a day to talk to smokers who want to quit. Kyle Obert called for help in October.
I was feeling awful. I was feeling really awful. I knew it was time to quit whenever the doctor gave me an inhaler because it was so hard to breathe.
He had 6 counseling sessions. Today, he is a former smoker who now, when stressed, twirls something other than a cigarette in his fingers. It's a replacement coping tool he learned from his quit coach, who also sent him nicotine lozenges to ease withdrawal symptoms.
I knew that I needed to try the patches or the gum or the lozenges, but they're so expensive, like so expensive, and I didn't want to go buy a whole bunch and then realize that they didn't work.
In the last few years, we've been serving about 38,000 Oklahomans every year. And our quit rates are anywhere between 30–35%, kind of depending on what level of service people are willing to take.
Despite TSET's success, the American Lung Association's 2012 State of Tobacco Control Report doesn't give Oklahoma high marks. For tobacco prevention and control spending, the state gets a D. That is because the Centers for Disease Control and Prevention calls for a yearly expenditure of $45 million. Oklahoma also gets a D for its cigarette tax and a D for smoke-free air. For cessation coverage, the grade is a C.
If you look at us compared to the other states, we're actually kind of middle of the road on most of these things. We used to have an F in just about everything.
Missouri has all Fs. Mississippi has all Fs.
Bob Wright of the American Lung Association says Oklahoma's grades have improved since last year.
TSET does an excellent job. They have excellent staff. They have excellent leadership. They have excellent people, and they know what they're doing.
Wright says Oklahoma's grades have to do with what the legislature has or hasn't done. For example, Oklahoma's cigarette tax is $1.03.
We're 45 cents below the average of all states. Then when you measure back against states like New York is number one, and they are at $4.35 per pack of 20.
Wright and others working to reduce smoking rates believe the biggest Oklahoma obstacle is legislative control over smoke-free air.
Presently, we have a preemptive law that says no one can do anything about smoke-free air workplace. That no community, no municipality, it can only come from a state level.
The Tulsa City County Health Department gets some TSET money to try and drum up support to change the law.
We have a big push going on to change that so that we can restore the local rights so the communities themselves can decide if they want to be smoke-free cities.
The Health Department's Vanessa Hall-Harper will be urging governing bodies in Tulsa County to draft resolutions asking for lawmakers to grant municipalities the power to create smoke-free ordinances. So far, Oklahoma City and 9 other communities in the state have already done so. Several major cities in surrounding states are smoke-free.